Well, hello, I'm Peter Chen from the Harvard's Medical Practice, and welcome to our very first webinar about pre-diabetes and type 2 diabetes. If you've got type 1 diabetes, it might not all be suitable for you. I'm sure you can find something better to watch. One of the concepts that we want to get across is thinking of type 2 diabetes as really metabolic bad weather. It's not even really a disease as such, but the consequences of a long period of overnutrition, which is really all too common in the West, when we just have enough food and water to eat. There's one thing we know in Scotland, which is how to deal with bad weather. So by putting in place big lifestyle changes together with medication, you can reverse a lot of these consequences of having too high a sugar level and live a long and healthy life. You hear a lot about a number called the HbA1c. This is an average of your sugar levels over about 6 to 8 weeks, and it gives us a good idea of your diabetic control. But remember, this isn't just about your sugar level. This is a complex series of metabolic events that's happened in your body. So things like your blood pressure, your weight, your cholesterol, and your overall hormonal health are perhaps just as important. And remember that the HbA1c level is really just a line in the sand that doctors and big pharma have drawn. So saying that you are diabetic when your HbA1c gets to 48, well, an HbA1c of 46 and 47, although you might be in that pre-diabetic range, is really not that much different. So anything you can do to move that HbA1c back towards a normal range is going to have huge consequences for your overall health. So today we're going to talk about how to manage your pre-diabetes and type 2 diabetes, thinking about medication, what you eat, the impact of sleep, how you move and exercise, even how you relax, but perhaps most importantly, how you put it all together and actually enact some of these lifestyle changes. So let's start with medication, because I think it's the area that I perhaps struggle most with. We just said that type 2 diabetes isn't really even a disease, but a set of consequences. And when you get told that you've got type 2 diabetes, we might start you on 1, 2, even 3 medications. So where do they fit in? And why should you take medication if it's suggested to you, when it won't make you feel any better? It might even make you feel worse. Well, one of the ways to think about it is in terms of just trying to put out that fire, that metabolic storm that's raging in your body first, whilst you enact those lifestyle changes. So sometimes medications can give us a rapid control over your sugar levels and start to prevent some of the consequences of type 2 diabetes. It's also true to say that the best time to plant new trees might not be whilst that fire is raging. So sometimes just accepting the need for medication, which you might be able to stop later, will allow you to make some really long-standing lifestyle changes that will stick and start to reverse some of these changes. And I like to think of medication sometimes as a bit of a health insurance policy. A lot of these medications are really just to manage your risk from having too high a sugar level in your blood. So whether it's controlling your cholesterol level, reducing your blood pressure, these things really are just balancing risk and slowly lowering that risk of the consequences of diabetes. And remember, they're not designed to make you feel any better. They're often just there to lower that risk. And they buy you time. They buy you time to put in place lifestyle changes, which are difficult, can take time, and the way that our society works, they are plain difficult to put into place, as we'll come to a bit later on. So let's talk first about what you should be eating, because I think it's really so confusing. One of the messages that you often get if you're type 2 diabetic is that you really shouldn't be having biscuits, cake, or adding sugar to your cups of tea or coffee. And that's true, but it's a lot more complex than that. It's not just about avoiding cake. If you do understand the concepts of carbohydrate, protein, and fat, then it is important to try and reduce the amount of refined carbohydrate that you're having, because your body just really can't process that in the way that it used to be able. But I think the simplest message to get across is really to have an unprocessed whole food diet, stuff that you cut from scratch, and eating as wide a variety of things as possible. One of the reasons for that is because we're learning about the key importance of those bacteria that live in your gut, which I'm going to talk about in a sec. Think about what you eat as really messages to our body, and perhaps food and fertilizer for those bacteria in your body. They're going to play a crucial role in what you absorb from the gut, and so how much sugar appears in your body that you then have to process. We're also learning that when you eat might even be as important as what you eat. So trying to eat your food in a narrow window of time as possible can be hugely helpful to stabilize and lower your blood sugar levels. So eating your breakfast as late as possible in the day. I take cereal to work now and I have it at about 10:30 to 11. I can usually hold on that long. And then your dinner as early as possible. For me, it's usually only about 7:30 by the time I get home. But after 7:30 and before I have breakfast, I won't have anything apart from water and some black coffee the next morning. Time restricted eating really is just a way of describing that process, and we're learning more about what particular window of time might be most helpful, but just think about squeezing those meals together and not snacking afterwards. Finally, how you eat might be really important too. Eating together with a loved one, with family, going out with friends, and trying to take time over your food and not just shoveling in stuff whilst you're still typing away at the keyboard. Eating al fresco and not al desco. This is just a diagram to demonstrate the gut microbiome, so these trillions of bacteria that live in our body. It's not just bacteria, it's also fungi and viruses that help us work out what to extract from our gut and what's going to be useful for our body. And they have a huge role to our immune system, switching on genes, and even might affect our mood. So try not to think about food as just fuel for the body, but as information, and try and eat the right things to grow the right bacteria that's going to restore your metabolic health. It's said that about 75% of what we eat in the West is just that refined carbohydrate. So that's stuff like, pasta and potatoes and bread that really doesn't have any nutritional value at all. It kind of keeps us going with calories, but it doesn't do us a huge amount of good. Use those things in small amounts as a vehicle to add in lots of other things. Don't be convinced by labels that just say, low fat. Often low fat means that they've chucked in loads of salt and sugar to make it palatable, and actually those things might be less good for you. So what about sleep? When I was at medical school, there was no way that we thought of sleep being important for our diabetic control. But actually, studies are now showing that, if you have 4 hours less sleep, 4 hours of sleep per night for 6 nights, you're just far less effective at actually absorbing sugar and storing it away. And actually, you can do experiments where you sleep deprive people and you will immediately cause a pre-diabetic condition in them. It causes you to be resistant to insulin, which is the hormone that circulates in your body and takes the glucose out of your blood and puts it into tissues for it either to be used or stored. So actually, thinking about promoting and prioritizing sleep can really help your diabetic control. It's easier said than done. This is the first photo of a family member in the churns. This is my son Ben, aged 5 months. We don't all sleep like that, do we? But there are certainly some things that you can do to promote sleep. Maybe the most important is just getting outside as early as possible and exposing your brain to natural light. It's going to start that circadian clock that tells the brain when it's daytime and then later on when it's time to switch off. It can take a huge amount of time to establish a good sleep pattern. So you've got to stick with it and try and go to bed at the same time every single night and get up at the same time every single morning, even at the weekends, and avoid social jet lag where you have a lie-in and it can actually be really disruptive. Caffeine, I'm sure you know, is hugely important. It lasts for such a long time in our body. It's a really powerful stimulant drug. If you've ever gone a week without coffee, you really realize that we live in this caffeinated state. I can't do without it, but what I do is stop drinking any caffeine after 10 o'clock in the morning, because a quarter of that dose of caffeine is still going to be there 12 hours later, which for me is roughly bedtime at 10 o'clock. 11 o'clock, something like that. And when you learn how important sleep is, there is this sort of paradox that it then becomes harder to get to sleep. You know it's so important. And your brain shuts off in sort of different stages. The first bit of your brain that switches off is that bit of the brain that's dealing with your kind of rational thoughts, that's processing the thoughts of the day and putting things into perspective. So if you're going to bed worrying about stuff, well, try and think positively about that. Great, you're going to be asleep soon. And just allow those worries to bubble up. Don't hook onto them. They will pass like the clouds and you'll be asleep soon. Screens are important. Actually, and we've talked for a long time about blue light. It may not actually be the particular wavelength of blue light, but what we're doing on our phones or screens that actually is disturbing our sleep. If you're watching sort of small videos on YouTube or responding to messages from your children asking you to look after the grandkids, actually it's causing a little spike of dopamine, adrenaline, and that will impact on your ability to switch off and go to sleep. So I try and really put away all devices for about 60 to 90 minutes before going to bed and avoid those requests to look after my mum's dog the next morning. So next, you all know that moving more and exercising is going to help your diabetic control and your overall health. But I think the way that we think about it has become slightly problematic. Talking about exercise implies that you put on Lycra and you go to a subterranean gym and listen to techno music and really suffer for 30 minutes or 60 minutes. And that's not what this is about. It's about just moving more throughout your entire life. Parking in that parking space that's furthest away from the supermarket, going for regular walks outside. Every time you can be moving around, move. I've got one of these Apple Watches that tells me throughout the day, right, time to stand. It's irritating, but it's really true. Sometimes you get consumed in a task and you find that you just haven't moved for a good, hour or so. So just getting up, moving around, and even incorporating some strength training is going to make a massive difference. This is something that I've been aware of more and more and more. As you get over the age of 40, you lose a significant amount of muscle mass every decade. And it's one of the big problems as you get older in terms of your mobility and your balance. So once you're north of 40, you really do need to start thinking about how to maintain your muscle strength and preventing what we call sarcopenia, which is that age-related loss. That doesn't need to be lifting heavy weights. It can be just incorporating these little movement snacks into your daily life. So things like doing squats in the kitchen whilst you're waiting for the kettle to boil, or things like yoga and Pilates, just things that actually improve your muscle strength, rather than just thinking of movement and exercise as burning calories and just wastefully using energy. Movement and exercise is really enjoyable. It makes you feel better, it improves your mental health, and it should be something that, it is something you want to do, not something that you have to do because you're told to do so by doctor, nurse, or diabetologist. And actually relaxation is really important, because if you're stressed, those hormones want to mobilize sugar into your bloodstream for use to run away from that zebra or lion. So actually incorporating things to help you relax is going to improve your diabetic control. One of the most crucial things for me is not exposing myself to stuff that I cannot control, that just makes me stressed and would increase my blood sugar levels. So I don't listen to the radio driving to work anymore. I don't have news apps on my phone, and I certainly don't have breaking news alerts. That BBC News, you've got to look at your phone, and then you look at it and you just find some horrible event that's happened on the other side of the world that just makes you feel miserable and unhappy, and will have an impact on your diabetic control. We can't tell you how to relax, but certainly, getting outside instantly lowers levels of stress when it's measured in kids and adults. And whatever it is, gardening, doing activity with friends, seeing people, speaking to the person in the supermarket, all of these things are going to just lower your stress hormone levels and improve your diabetic control. I kind of had this idea that it might be more helpful to write down things that you're grateful for than your blood sugar levels each day. So that's a lot of information about the lifestyle changes you can make. Well, how do you actually do it? This is difficult in our busy, frantic lives. And I've heard that it often feels unfair. You'll all know people who are your size and shape and age who are not diabetic. So why has it happened to you? And it's bad luck. There's going to be a complex interaction of environmental factors, your genes, and what you've eaten and drunk and how active you've been in your life. But you've got to play the card, the hand that you're dealt. And it's now really important to make those big lifestyle changes, even if your mate in the golf club or the friend that you go walking with can have that, large slice of cake after a walk. That's unfortunately going to have consequences to you and your metabolic health. A 7 and a 2, if you play Texas Hold'em, is apparently the worst hand. So you should fold at this point. Nobody watching this is going to fold, because you're going to be dealt a better hand than that. One of the key concepts to think about is how your motivation changes even through the day, and particularly through the year and through your life. And that's normal. When your motivation's high, when you're watching an inspiring video about managing type 2 diabetes and pre-diabetes, you can do changes in your life that are really quite hard. Same is true with New Year's resolutions, but on a Friday night after a difficult week at work, or when you're giving your grandchildren back to your ungrateful children, it's going to be very hard to resist those unhealthy choices, whether it's cake or drinking too much booze, whatever it is. So the most important thing is actually making these lifestyle changes as easy as possible. There's a guy called BJ Fogg who runs a behavioral change program over at Stanford University in the States. And he's really changed the way that we think about how to promote change over the last sort of 5 to 10 years. And what he looks at is the difference between your motivation to do something, which we've said will vary, and the ability to do it. So if you look at this graph over here, so things that are difficult to do, that's the bottom left-hand corner. Well, you can do those things only when your motivation is really high. There's a line that goes across this, the line of action. Think of it as sweeping down between 1 and 2, and everything to the top right of this in the green area you're going to do. So we need to set changes for when your motivation is at its lowest. We're talking about Friday night, the grandchildren have been horrendous, you've had to work, your children are ungrateful, and we want to make some changes that are so easy. Things like not having that unhealthy food available in the house, having less alcohol in the house. Here are some ideas. We've talked about exercise as not meaning getting in lycra and going to a gym. So what can you do at home? Here's a shining example here. All he needs is a beautifully lit living room and a yoga mat. And here he is just doing some strength training, some balance work just at home for a short period of time. Having some prompts is important. So, could you stick a new movement habit onto something that you're doing already? So, whilst you're waiting for the kettle to boil, Rangan Chatterjee talks about doing some squats, some simple dips on your kitchen counter, things that will improve your muscle strength, prevent sarcopenia, and you'll remember to do them. I've put a chin-up bar outside my son's bedroom, and every time I deliver the ungrateful sod a cup of coffee, I try and do 2 or 3 chin-ups, which is actually really difficult for me because I'm so weak, but actually I think is going to make a difference to my upper arm strength, I'm sure you can tell. So, little things like that. Another friend of mine, Dr. Ash Bhatia, he talks about toothpaste stickers. So he writes little notes on his tube of toothpaste to remind him either to think about something or to do something like, stand on one leg when he's brushing his teeth and working on his balance. It can be really, really effective. Try and make really small changes. It's a horrible trick of human nature that if we set our goal too big and we can't achieve it, we give up. So if you decide, well, this year I'm going to run 10 kilometers every day, it's just too difficult. And when you are unable to achieve that, it's human nature just to give up entirely. So setting the bar a lot lower is much more likely to lead to good habits that continue on through your life. And that's really what we're looking for here. And just start. There's the old Chinese proverb that the best time to plant a tree was 20 years ago. The second best time is today. So, just start making those small changes. You don't need to wait for the perfect option to present itself. I've mentioned things like accountability and streaks because actually doing something with somebody else actually can be really motivating. As our streaks, challenges. So my wife and I did a 30-day yoga program, Yoga with Adrian on YouTube at the start of this year. And we found it really easy to stick to it. For the rest of the year, it's much harder when you try and fit it into a kind of ad hoc slot into your day, and it doesn't happen like we've said earlier. So doing it with somebody, setting yourself a challenge through the year, that can be really motivating and helpful. And I think this is really important. We're just trying to move the needle. We're trying to, get any weight off, lower your blood pressure a little bit, move the HbA1c back towards normal. Don't be discouraged if there's only small movements. It will still make a difference, and you should feel good about it. And is there a holy grail? Can we cure type 2 diabetes? The answer is probably yes. You can certainly send it into remission, and one of the options available to you is referral to the weight management service, where they do offer an ultra low calorie replacement diet, and that is likely to send your type 2 diabetes into remission. It's really hard. We're talking about something like 1,400 calories for women, 1,800 for men, and living in that negative calorie balance every day is really difficult. You're likely to feel pretty awful during that time, even though it will have positive consequences for the rest of your life. I always think about Steve Redgrave, the Olympic rower who he trained so much that he said that he felt constantly terrible. You don't think of Olympic athletes as feeling really kind of low in energy, but that's the sort of sacrifice that you might need to make if you really want to send your diabetes into remission. It is possible, but it's certainly really, really difficult. And And you're not doing this alone. You've obviously got the team here at the practice. So, our practice nurse is Julie Salim, who are just expert in diabetes care. All of the GPs are there to help you. And we have weight management programs. We have the diabetic clinic. We have links workers, Dahlia, who can refer you to local services that can help. So you don't need to do it alone. And maybe those community services are just as important as your doctor or nurse. I would think about the walking groups, the knitting groups, the folk that you speak to at church, the folk that you talk to on the beach, as being just as important to your diabetic management as the healthcare professionals. So thanks for watching. Hopefully there's some ideas there that might really improve your diabetic control, and enjoy the process. Best of luck, and together we can certainly maintain your health, and we can get an awful lot healthier, but you're not in this alone. Thanks for watching.